Okay, hi, good afternoon to everybody. What a great day I arranged for you all, and you reciprocated by providing such an incredible view, so thank you. It's great today. I'm Ginny Pribanic. I'm an entrepreneur, and I've been an entrepreneur ever since I graduated from Tepper, and I committed myself to working with technologies largely outside of Carnegie, that were derived from Carnegie Mellon, and partnering with the researchers and the inventors to bring to it the commercial and the business side um, of the solution. So that's where I've been focused. And I love being an entrepreneur. I don't think there's any other way to live. I think it's, for everyone, it's an important part of living your own life, living your own dream. And I'm not sure I cleared it out of here, but if you're not living the big dream and you're not going after your own and you're not pursuing it as an entrepreneur, then you'll be working for someone else, pursuing their vision. So I'll plug this all. Everybody, go after your own. Have the big dreams. A little bit about myself. I have been clinically diagnosed as intense. And I think that's I'm proud of that. And I think it really is almost redundant having gone to CMU. By definition, this is probably something you all suffer from as well. My undergrad is from the University of Pitt over there. My MBA is from Tepper, and I'm proud of being a thorough Pittsburgher here. So I've started a couple of startups. The first two, one was in lighting technologies. We were doing fiber optic lighting to light up refrigerated cases in grocery stores. The benefit there is you were taking the heat of the lamps outside of the refrigerated area. And that was really a fun project. We were doing that with Hussmann Refrigeration. The problem at the end of the day is we couldn't match the price point of traditional lighting. So it didn't succeed. But it was, one of the things I've always tell people is the success of an entrepreneurial startup is doing it and achieving the milestones along the way. Sometimes they won't go where you expect, and 90% of startups don't. But there's never failures in startups. You're going along the path and learning the next thing. After the lighting technologies, I actually did a program here in Pittsburgh called Stadium Games, where we turned the scoreboards at Three Rivers Stadium into an interactive video game. So the two sides from representing the two teams would cheer, and they would kick the other team's helmet off the scoreboard. And that was done with a couple of researchers at CMU who were very, very innovative in animations and art throughout the city. The startup I'm involved in right now and have been involved with for about a decade is MedRespond. And what MedRespond does is it uses technology developed at CMU to simulate a conversation. And we use videos to make you think you're talking to that video, and we use NLP to interpret what you say and to understand what you ask. And we use streaming media, and we have a conversation. And what's happened, I was going to show it to you here, but when a patient is going to have open heart surgery, they show them the program. When the patient gets there, they meet their doctor.
Fit for surgery program. We developed this program because we wanted you to have an easy-to-use, interactive tool giving you all the information.
Throughout the program, the doctor will ask the patient, and based upon their response, they'll go down different paths. The patient can ask questions at any time. And the big thing we've got there is the most important thing. Now we're talking about healthcare. What we've done in healthcare that's most important with this technologies is we've shown the impact. So we created the program for open heart surgery. We installed it in 2015, actually, and we took the first 200 users of that program. So you're going to have open heart surgery in 3 weeks. When you meet with your surgeon gives you access to the program and says, very important message, this will help you have a better outcome. That drives a very high utilization of people to go to the program then. When they go to the program, they see their doc, they see their team, and the information is broken up into what you need to know the week before, the day before, during your surgery, and on the way home. And the program asks things like, do you have someone to care for when you're home? And so you can flag and respond to things well in advance of the actual surgery. On average, the average patient uses this program for an hour and a half before their surgery. And that's an unheard of level of engagement. People go to conferences, then they brag about 5 minutes. Think about the times when you've gone to a doctor and they've given you that post-discharge with those pieces of paper. When did you ever find them? Have you ever used them? There's really the utilization in the area that we're tackling here with patient engagement. The problem is people don't use it. People don't want to use it. People don't access it. They don't spend time with it. What we've shown is we've got an hour and a half worth of utilization. The other thing we've got is this hospital system and this organization, their patient satisfaction and communication scores went from 93 to 99. So that's a nice survey and that's great, but what's really important is healthcare is those survey scores determine your reimbursement rate for Medicare. So that if your scores go up versus down, it can change your reimbursement rates by about 2%. Now that doesn't seem like a big swing, but we're at a business that the margin is near zero. It's a tough place. So if you can swing from black to red, you've made an enormous difference in this system. Bigger difference, and I guess I saved the best for last, is after 2 years of implementing this, our client took the people who utilized it during that time and compared it to the people who did not. Same location, same doctors, same surgeries, same time frame. And what they found is there was a statistically significant difference in the post-discharge costs. And so what I'm telling you is a very important thing about healthcare. If you want to get into healthcare, you have to prove that you have an impact on the bottom line. You have to also prove that you do no harm, but you have to have an impact on the bottom line, and you have to prove it. And that takes a long time and is a very big challenge about getting into healthcare. What we found is, in this research, is that when the patient was having their surgery, both groups were almost identical because we weren't targeting surgery in hospital procedures. But the 30-day post-discharge, the first 30 days you're out of the hospital, we reduced those costs by 50%. And why? It's because we interviewed one of the people and said, what did you do differently because you had this program that you wouldn't have otherwise? And he said to us, I used a clean towel after every shower. I normally don't do that. He said, I think that probably helped me not have an infection. So we reduced the infections, we reduced the readmissions, we reduced the complications. There were lower levels of medications needed, painkillers and things like that. And when we were coaching patients, one of the things we encouraged them to do is don't go back to your cardiologist, go to your primary care physician now for follow-up. And they did. What we found is in those post-discharge patients, those costs went up. So very, very important. We had the target, we implemented the intervention, we measured, and we got exactly the outcomes that we needed. And it's closing that gap that has really enabled us to penetrate. We're following a sort of a land and expand model with our program. We get inside of a healthcare system, start with cardiology, and move over to the other surgical areas and other non-surgical areas. And then we move into the next clinical system. So we're working with Highmark. We're now working with the Cleveland Clinic, and we'll be expanding out from there. So we're at the point now where we're able to raise funding. We're closing around right now So it's a very exciting time. And the one thing that I love about, I said one of the things I think is important about an entrepreneur's passion, we're really making a difference for people's lives. They're handling these surgeries better, they feel more comfortable, their families feel more comfortable. Everybody wins in this kind of a solution. So I'm particularly proud of that. I'm also proud of the fact that it's basically a $40 billion industry that we've entered into now. So that is promising of the places we can go. So with that technology that I showed you early on, one of the things we had to decide is we could go anywhere. We can go in sports, we can go in entertainment, customer service. Why healthcare? What's the big deal about healthcare? Well, the one thing, I think you all know this already, but I'm going to bore you with, it's really, really big. So in 2017, healthcare spending reached $3.5 trillion, 18% of GDP, and it's continuing to grow, which is a problem. That growth needs to be corralled. It's a huge problem for us. Within that, there's a lot of spending within that $3.5 trillion, but two sectors make up more than half of that spending: hospitals and physicians. So over 50% of your costs are going into those two areas. That's where we targeted. So we're going into the provider base. That's where we're going. The healthcare industry, if you're targeting it, it's really easy to find. You can get a map and a layout of the land in healthcare very, very fast. The number of hospitals, the staffed beds, the total number of admissions, the number of expenses for all U.S. hospitals. You can go and find so many resources where you can break this down to the surgery level. What's the average cost of surgery? I mean, there is so much data available in this system about healthcare, about the industry. There's also the industry analytics. There's a lot of organizations. There's a lot of periodicals. So from these views and those values, this is a dream area. I mean, it's like, what could be better? Well, the problem is it is really a very, very slow innovator. It's really slow to take up innovations and change. And why is that? It's because of the nature of their business. They're not making ice cream. They're saving people's lives and potentially killing people. Innovations have been the cause of death in the past. They don't accept things lightly. They expect it to, they have to be proven that it works and proven that it's safe. The healthcare system is highly complex. It's highly regulated. With the evolution of, there's an evolution, and it's very complicated the way everything is paid for within the healthcare system. So once you figure out your product and what's the benefit that comes from that, then you have to sort a rather amazing maze of who's valuing that, who's going to benefit from it, who has a line item that this fits into, and who's going to pay me. And the systems are under incredible pressure. They're just being called upon to do more with less, and that pressure is often falling on the individuals who are doing the jobs in that system. The physicians, the clinicians, the nurses, the staff, some incredibly, incredibly overworked. I had an opportunity to interview people who had sat through a presentation I did, and it was just really, everybody was thrilled and excited and so eager to move forward. And 2 months later, nothing had happened. And I was able to meet with one of the people in the presentation, and I said, well, I just thought we were ready to go at that meeting. What happened? And he said, well, it's what happens to all of us. We sat and we saw something that was innovative and exciting, and we wanted to do it. And then I went back to my desk, and I saw a stack of things that were this long and this high that had to be done, that couldn't wait. And I knew I didn't have another minute to be able to pursue innovation. So those are all really true things. That doesn't mean you turn away from healthcare, but it means you need to go in it with your eyes open and understanding just how difficult and long the sales cycle can be, and how highly likely a particular sale is to fail. I saw some statistics by a really seasoned sales group that said their expectation was much, much lower for any other industry. And when they have a qualified lead and they pitch it, their expectation is at that level, they'll only close 18%. And it's because of all the things we're talking about today. Can I ask real quick, is there anybody who has a company or is starting something that's targeting healthcare already? No? I hope I don't discourage you. Let me ask another thing. Do any of you have healthcare backgrounds? So that's my key thing. If you're going to start a technology, if you're going to start a company going after healthcare, don't go in it with a team that's a generic IT team or a generic developers team. You need to have that insider understanding because this is a complex industry. It uses different language. It uses different expertise. And I can't tell you how much I think it's imperative that you have someone who really understands that industry on the team. Because if you go in and you use the wrong language, remember this is a group that has a really high bar to not bringing in something that's going to harm their patients. And so the measure of what kind of care you get in healthcare is the current standard of care. So with your innovation going in, you have to improve upon that standard of care. And above all, you have to cause no harm. This is a group that is dedicated to the Hippocratic Oath, which was developed in 400 BC. And they still swear by this oath that says, above all, do no harm. And they take it very seriously. Part of that oath also says, I'll build on the expertise that has preceded me. I build on the shoulders of those who precede me. But again, they're not going to gamble on a new technology and not going to gamble on an innovation. And so not only do you have to cause no harm and improve upon the current standard of care, but they expect you to do it more efficiently. And then they expect you to prove it. So here's your challenge as the innovator's dilemma is I have this great idea, I want to sell it to the industry, and they say, well, prove it works. Can't prove it until you buy it. And so how can you create that opportunity to be able to find a partner who will enable you to experiment to get to the point where you can actually have the data to show that your innovation is better, it produces results, and it does it cost effectively. One of the things that really magnifies that challenge in healthcare is the data. The data inside of the health, I told you that we have a lot about the industry, but once you get inside of a hospital, the data is really in bad shape. I think I read something like 77% of individual clinics still do paper billings. How can that be? There's a big push for interoperability so that, the big push was to put in your electronic health record. That's been a fortune. Hospitals have spent often as much as 1 year's worth of revenue invested in implementing an electronic health system. I was at one of the hospitals here that was installing Epic, and we were in the cafeteria, and half of the cafeteria was filled with the Epic consultants who were managing the implementation. I mean, it's really a difficult and a very complicated system, and it's being tackled. The electronic health records are rigid. People aren't used to them. For a lot of people, it's new. You'll see a lot of complaint about the electronic health record, and sometimes one of the things more recently they found is newer doctors are not as opposed to the electronic health record as doctors who have been in practice for over 20 years. So the other problem is, so I have one system that tracks what we did to every patient, but the billings for all of those things are in another system. So the claims data is not in the same place as the clinical data. Problem is, if I'm trying to prove the cost effectiveness, I've got to marry two disparate systems that don't use the same levels of information. And the kind of analysis that you would expect to be able to do in a week in another industry could take months within here. So proving that when you go into your innovation and your business, make sure you have a work on this. Try to map out the strategy of how you're going to do this proof statement right now. We are working with clinicians right now. We're creating new programs for transplant patients. And what we're doing is right up front, we're targeting all the evaluation metrics, and we're identifying where they are internally and how we're going to track them and what the success factors are. And it sets the expectation from both, because now our client goes in realizing that not all the things we wanted to impact can be measured because they don't have the data internally. So it's a really important part of going into the healthcare industry is to make sure you know that you can prove the efficacy of your innovation. The other point, hospital systems are really complex. So once you have this great system, each hospital system is independent. There's been a lot of mergers and acquisitions, and they've just really made really complex organizations. Most of these hospital systems have several hospitals. Some may have 7 to 10, some have 30. They also, around that, they have hundreds of physician practices, outpatient centers, labs, clinics. Each of these are staffed, each of these has a management team. Then there's system level management, and then there's hospital level management. And within that, you have the clinical and the administration. And then you also have service line leadership. One of the big innovations that Cleveland had introduced is that they didn't manage each hospital individually, they managed it by service line. So all of cardiology, no matter where you were, reported to this center group. So now you have the cardiology managing across the hospital. You're starting to get the picture of how complicated this can really be to make a sale. Because at the end of the day, it's really those people in the front line who often determine whether or not a product gets used. And so you better really understand who you have to convince, who's going to buy, how long it's going to take. This complexity can explain why some of the sales cycles are 18 months. And so, I know, because I've been there, where you map out these revenue models and you want to say that you're going to grow, you're going to triple every year. Not with an 18-month revenue cycle, you're not. So now there's ways of compensating this that, but you have to consider that in your strategy. If you partner with someone who already has an access and a base within the hospitals that can bring you into these systems, that's the way to go. It's just for you to really take on the individual sales within the complex hospital systems is really daunting. The other point you've got is healthcare is highly regulated by the FDA, JCO, legal requirements, compliance, the internal review boards, there's confidentiality and HIPAA and data security. So we're doing these communication systems to patients. We have to go through legals, we have to go through a compliance review, we have to go through the internal review board to make sure we're not saying anything inappropriate to all of the patients. We have to prove that we have the right security and HIPAA, a HIPAA secure environment. And all of these are audits that you go through within each system. So it took a long time to get the sale, and now look at all the burdens to implementation. What's the good news? Once you get through it, you're on the inside. And that also creates a barrier to entry. for other people. So just like any other barrier to entry, you have to meet it first before you can put it behind you. But this is really daunting. And why is it so disciplined? Because these penalties can be significant. I don't know if you can see, but the HIPAA violations where you disclosed patients' personal information, $50,000 per incident, up to $1.5 million. And these are things like, one of them I was looking, they were doing an interview with a local TV station, and there was a patient's confidential information sitting on the desk. And they got fined $1 million for that. So this is very real. If you screw up, you could also end up with a malpractice suit, which, in addition to the financial burden, which is huge, it's really traumatic for a doctor to be called upon and be accused of malpractice. It's a huge blow. It's really daunting. These settlements, $62 million, $60 million, $30 million, and what's the defense whenever you go into a malpractice case? It says, did you use the standard of care? And one of these, one of them said it was using something that was not proven. So think about it. This dog adopting your innovation could end up with a settlement in $60 million because it wasn't the standard of care. It was an unproven innovation. And again, that's amazing. So I've already said the system is complex and the regulation is complex, but there's also the buying process can be very complex because decisions are siloed. So you have one group that takes care of the hospital stay and there, and you have another group that is responsible for long-term care. Well, what if your invention needs to be implemented during the surgery, but its impact is that in long term the person has a much better recourse? You actually have a situation now where what you've done is the person who has to pay the $100,000 is only going to see an expense, and the person who saves the group that is realizing the savings, it's downstream, and the healthcare system has not come to grips with all of that. There's such a matching up the expense with the benefit of a healthcare implementation is really a big challenge. Decisions are often siloed by disease. They're often siloed by location. So it really is the way systems buy is very challenging. There's many decision makers at both levels. The doctor needs to agree to be able to use this innovation. That hospital has to agree to use it. The nursing staff has to support it. Then the financial people have to agree to pay for it. There's all kinds of committees that will have to review it and make sure, is it appropriate to the standard of care? Does it violate any of does it meet patient safety? Just so much scrutiny within the system. And to make matters worse, there's evolving payment methods. So what is there today is going to be different or is evolving. Some surgeries have one way of payment, some have others. And you've probably heard about this. Traditionally, all of healthcare was fee-for-service. So if you had 3 stitches, a broken leg, anesthesia, and follow-up care, those were all line items on the bills and they got paid. Well, what's evolving now, so here's what that means. So in the Fit for Surgery model, I told you that we reduce the cost for the patient, for the hospitals that use it. Well, under a fee-for-service model, all we've done is decrease the revenue for the hospital. Because they don't pay it, the insurer pays it. So it's the insurer who will say that $4,000 per patient. But they can't buy the solution because they're not in charge of the care plan. So you've completely separated that model. You've said if I innovate healthcare and it costs less, you've decreased my revenue. But now, so everybody recognized that that's a screwy model. So the move is now to go to bundled payments, so that if you're going to have an open heart surgery, the hospital gets a budget for $50,000. That's what they're going to get paid. And if it costs them 52, they eat it. If it costs them 45, they made money on it. And more we're moving to that. There's sort of a hybrid that I've seen. I told you we're working in the liver transplant space. The way the liver transplant works is there's a negotiated fee. So they look at each case and they go, this is a standard liver transplant, that's $700,000. And that's actually about the negotiated rate per liver transplant. And you're going to get that if you manage it more, if you manage it less. But now you've put the benefit of managing it the right way into the people who can actually impact that process. So, this is the way it should be. And then you actually have the situation where, what if you do something that benefits somebody in a fee-for-service model, so you increase their fees, but then they shift to bundled payment, and now they're actually getting penalized because your solution costs more than an alternative. So it's really, am I being clear on that? Is that clear how screwy that is? So, we actually had a situation where we were going to implement something with lung cancer patients and said, we think we can save $30,000 per lung cancer patient. And one of the docs said, you're just decreasing my bills. You're lowering my revenue. How is that good for me? Under today's model, it's not. Whenever you get a standard fare for fixing a lung cancer patient, they will get the benefit, and it will align the benefits with the delivery in healthcare. So the other point I was making is that the providers are incredibly stressed. How do you get their time? It's hard to get their time. Most of the meetings I have with docs start at 7 a.m. or 7 p.m. They're the victims of doing more with less. They're all overloaded. They're stressed. The hospital systems are operating under razor-thin margins, so they can't increase staff to do these things. People look at the innovation, and all they see is there's another thing I have to do. And it's really a threat. If it's not a threat to the doctor who loves it, it's a threat to the staff who's going to have to implement it. The staff can be often very cynical about what you're promoting is going to help them, is going to be better for them, and if it's not going to just be more consuming of their time. So one of the things that you have to do is be very careful to make sure you're gaining support of the people who will use it. If you sold it to the doc, and the administrators in the clinic are the ones that have to introduce it to the patient, they can kill the innovation for you by the way they sell it. So you need to get everybody in the workflow and your innovation on board in order for this to work. And the focus of any innovation, one of the key selling, you've got to make it easy to buy and easy to use. It really, I don't think there's an industry in which the ease is more significant than in healthcare, because you're dealing with buyers who don't have a lot of time. They don't have a lot of time to dedicate to customization. They don't have a lot of budget and hours to allocate towards that. And it can't interfere with their workflow. It can't increase their burdens. One of the other things you'll find is that sometimes the personalities within a hospital system or within a clinic can impede the adoption of a technology. There's a great investment in the status quo. If you have a physician who developed this procedure that they're currently used 20 years ago, there's no way that physician wants to try something else. They know this current procedure doesn't harm patients. Why would they want to take on something new? And the physicians, by the nature of, there's a lot of studies that show the personality of the physician, they want control. They know a lot. They've spent a lot of hours going to school, and they know better than anybody what needs to happen in this scenario. Um, Sometimes you have conflicting motivations within the teams. Um, do you want to treat this patient with surgery, or do you want to use a non-invasive approach? You can have those kinds of challenges. I'm not invented here. Nobody does it better. There's a lot of reputations from some systems that if you present something to them, they'll replicate it internally. So there's all of that. You really got to know and understand the hospital systems that you're approaching. And how many people can lengthen or stop the sales process when you get into hospitals. I mentioned there's a complex system of payments, and it's because there's third-party payers in most of these systems, either governments or payers. And so if you have a new innovation, it's going to be paid for by a third party. And that third party has something called a formulary or an agreed list of what they will approve and how much they'll pay for it. So now you have another layer of selling and sales and acceptance. So you not only have to have the doc, you have to have an agreement for the payers to reimburse based upon, to compensate you for this item. And the insurers may disagree because, Medicare has patients that may be the Medicare patients may be with them for 2 decades. And so they may want to invest in something that will have a long-term benefit. But a commercial insurer typically has 20% turnaround every year. They're going to be less willing to invest today in a big ticket item that may have a long-term payoff. So again, more complexities in the system. This is just this is a chart that shows there's 340 million patients, how the breakout of their payer network works. So 65 or older goes to Medicare. Then you have non-institutional and you have military. Then you break out the non-institution, employer-based, other coverage or uninsured. Then you break out the other coverage into those versions. So this can get further and further complicated. And so you're implementing an innovation into a system that has to please all these payers and all these alternatives in order to work. You can't implement a system that says, we'll do it one way if it's this kind of patient and another way if it's that kind of patient, because that would be just too disruptive to workflows. So what's the takeaway for the entrepreneur who wants to go into healthcare? And so don't give up. The thing is, in today's healthcare system, don't target an innovation or don't propose an innovation that means we're going to have a completely new way of doing heart surgery. Target innovations, target fixing things that don't work and keeping things that do so that you have an easier path to entry into the system. Focus on ease of use of your product. Make sure you understand how it works in the healthcare delivery system for all the stakeholders. Be able to answer everybody's questions. Understand the buyer process, who's going to buy it, who has the money, and why would they buy. What are the alternatives? And remember that a big alternative is not to do it at all. There's a lot of things that aren't being done today that if you had a solution, it would improve a problem. But if it's not being done today, there's not a budget line item for it, and people aren't accustomed to it. So it gets to be challenging. Once you get a sale, after you've jumped through all these hoops, once you have a sale and you've been able to do it, you have to be able to understand how you can scale that immediately. So work through all of the challenges of scaling way up front. Don't put those to the end. Make sure you have the scalability solutions built into the solution that you first deliver. Prepare for a long sales cycle. And what that means is you need more funds to survive. We say that 90% of startups fail. they don't really fail, they run out of money. It takes longer to get the revenues, it takes longer to collect the fees. So before you embark on this path, realize it's going to take a lot more funding than you expected. The revenues are going to be slower. And that represents another challenge for startups in healthcare. People can go over to a standard IT and they can get their money out in 2 years. You have a healthcare innovation and you can't even get the data that you need to begin to really launch your product for 2 years. That's a challenge. You have to have the right investor to come and support your product, who already understands that these kinds of challenges are a nature of the industry and not a nature of your approach. Prepare for low success rates. You're not going to have a close rate of 80% in this industry. You're going to have a very low close rate. So you're going to need a big, expensive pipe. But the other thing is never give up. If you have a good idea, just keep going. Keep going and keep going and keep going because, as my friend Babe Ruth said, it's hard to be the person who never gives up. So I'm welcoming your questions, and I'd like to talk a little bit about what's your reaction to what I've said. Yes? I'm going to have to, there are a lot of great books. I'm going to have to pull something together, and I will give it to Allison. I'm going to take that challenge on to give you like a little reading list for this, because it is complicated. Like Toby Cosgrove, who used to run, he did a book about the Cleveland Clinic Way, which is good. And there are a lot of good, let me get together a list and give it to Allison. Will you be able to distribute it to them? Because it is really complicated, isn't it? So Elena is with the Jewish Healthcare Foundation in Pittsburgh. And can you explain what? Are there, because I know you guys have always been into innovation. Is there anything that I've said that resonates or doesn't resonate with? And how to prove it. So I haven't been exaggerating. But can you, what's the Kaiser, is it? If you send it, I'll include that in what I provide to Allison. It's almost like there's more than you can almost absorb out there. The Jewish Healthcare Foundation is, do you fund initiatives and startups?
We do both, so we also accept grants. So there's a lot of grants that we work from other staff, but then we also have small grants for various programs, especially maybe programs and like to fund innovative ideas that are then going to be based. Yeah, it's sort of, as I said, it's a startup, so we're still finding quality.
But even today, if someone in this class has an idea they'd like to run by you, could they contact somebody? I'll put her contact information in the stuff that we put together. And so there's a conference, there's a program coming up in Cleveland called the Medical Capital Innovation Competition. And it's this year, the focus is on AI to improve innovation. And the first prize is $50,000. 2 years ago, I won first prize, so I can vouch for this. This is a good experience. But it's a process where you have to submit not a full business plan, but a write-up of your concept, and then they select about 25 finalists in the education category and 25 finalists in the for-profit category. And then you spend 2 days in Cleveland going through practicing your pitch. And then you have a final day where they give away the prize and give you a pitch. The other thing that's very nice about that is, in addition to the money, they give you access to the local hospital. So when we won, we were given access to Cleveland Clinic Innovations. And they spent several meetings with us, helping us to think through the business model, think through pricing, and answer, they had the wealth of, they have this incredible wealth of expertise on their staff to really advise you and give you advice like that. And that's coming up, I believe it's in April, but I spoke to the gentleman who's managing that, and he asked me to please encourage people. Nobody from CMU has submitted an application yet. And he said he'd like to see some applications coming from Carnegie Mellon. So in that email that I give to Allison, but it's the Medical Capital Innovation Conference. And I really encourage you to do it. April 17th is have you heard of that? I'll make an introduction to you with Matthew because they're really eager to make those relationships. Any more questions? I'm sorry. Did you have a question? Yes.
So you were mentioning about it's hard to prove the evidence, hard to prove the benefit of the work. So I understand you did surveys. What apart from that do you prove the impact of the work? In parallel surveys, or how do you go about it?
So we did all of that, and I'm hesitant. So right now, we're working on another project that we're innovating, and we're actually doing a capstone project with the Human-Computer Interaction Institute. And so they are going through the entire design process with patient interviews and storyboarding, and we are doing exactly all of that process in there. And it'll be part of our plan and how we're doing it. So yeah, they're going actually to Cleveland with us this weekend to meet with all the transplant clinical team. Yes?
Oh,
No, yeah, I think so. Yeah.
It seems like data organization is such a big problem, and so I broke my foot and I've had to go to multiple hospitals, and it's such a headache to get these
Epic.
It's so nice to have, like, I have a third-party company that I just have all my health records on, and every hospital can accept this paradigm of health records. Is no one trying that, or are they trying that?
Well, Epic, but it's such a mess.
What's trying?
There's a company called Epic that is doing that. EPIC. I sat on and this is, we've got all the hospitals, they have all their own systems, and all the insurers have all their own coding systems. Everybody's got their own ID for their patients. I was sitting in a conference one time, and they were talking to the head of innovation for the U.S., and he was just complaining about all the things I talked about right now. And then they had the head of the systems for the UK. And they said, he was saying, I don't have any of these problems. We have one system, we have one code. I said, I just tell people what I want them to do and how it's going to work, and they do it. And, you know, we've got the wild, wild west in healthcare. We love it that way, but, you know, we're paying a big, big cost for that lack of conformity. And there's companies trying it. There's a lot of other, you know, new platforms trying to layer onto it, but it's just such a big problem. Do you know anybody who's handling it well, Elena? Well, I mean, there's a lot of people throwing a lot of money at it. It's amazing. You know, it's like you look at everybody here at CMU, you go, what? You guys haven't figured this out? You know, but it's not. It's still a problem in the industry. Well, as I mentioned, we were doing the project in lung cancer, and I wanted to be able to access the health record and pull out the stage of cancer and the type of cancer. Wasn't there. So you could derive it if you looked at a bunch of, but the very basic things that you'd want to know to be able to get that. Let me take 2 minutes and see what's going on with this patient. You have to read 20 pages and figure out, oh, then they did this, then they did that. I was listening to somebody talking about the fact that an error had been encoded into a patient's record, and it took them 3 years to fix it. And it's like, really? And I just don't, you know, again, I'm not an expert on this, so I shouldn't say too much because it's not something that I have an expertise in, but I've certainly dealt with all the implications and the ramifications of it. I know we've come to our end of our time. But I encourage you to go into a healthcare, fix this mess. You've got all this intelligence and brilliant solutions and brilliant minds. You can do it. So